So probably the biggest challenge when a patient develops malaria symptoms in the US is that doctors in this country are not familiar with the diagnosis of malaria, the symptoms of malaria, and often not even the treatment of malaria infection, just because we don't see it that often. We really wanted to understand what pediatric malaria was like in the US, where those patients were traveling, what symptoms they were developing, and how they did in terms of being diagnosed and treated for malaria once they returned to the US. We did a retrospective review of malaria cases at 9 hospitals across the United States. And we specifically chose hospitals in different parts of the country to try to give us a better sense of what malaria, pediatric malaria was like in different regions of the United States. We looked at cases of severe malaria within our cohort, and severe malaria is a subset of malaria infection where people have specific symptoms or clinical signs that indicate that they have more severe disease. Severe malaria is considered a medical emergency, and if it's not treated promptly, could lead to seizures, coma, and even death. We looked at these patients to try to understand what made them different from patients who developed uncomplicated malaria. And while some of the things that we found were what we expected, patients who were infected with specific species of malaria, one species like Plasmodium falciparum, were more likely to develop severe infection. Some things were less expected. For example, we found that patients who had a delay in the diagnosis of malaria, often presenting to a clinician or a hospital with symptoms and not being tested, or sort of where malaria was not considered, those patients had a higher risk of developing severe infection. So that delay in the diagnosis and subsequent delay in treatment put them at higher risk of severe disease. And patients with severe malaria, while most of them did well after treatment, tended to have longer hospital stays. They were more likely to require a blood transfusion, and they were more likely to also receive antibiotic therapy in addition to antimalarial therapy. The main takeaways of our study is that it really highlights areas where we can do better at taking care of patients before they travel to prevent malaria infections, and also sort of identifying malaria earlier in patients when they return from travel.